First aid kit for heat stroke 101, immediate priority care for heat stroke. Features *1. Cool packs, gel-based packs that can be cooled in a freezer or refrigerator. They are essential for lowering body temperature. 2. Electrolyte solutions, oral rehydration salts or premixed electrolyte solutions to help replenish lost salts and fluids. 3. Cooling towels, towels that can retain moisture and provide a cooling effect when draped over the body. 4. Spray bottle, for misting water on the skin to aid in evaporation and cooling. 5. Thermometer, to monitor body temperature accurately. 6. Shaded shelter or umbrella, portable shade to protect the individual from further sun exposure. 7. First aid manual, detailed instructions on recognizing and treating heat stroke. 8. Hydration bladder or water bottle, to ensure the affected person has access to sufficient drinking water. 9. Fan or handheld misting fan, for increasing air circulation and evaporation. Cons and known issues *1. Limited cooling capacity, cool packs and cooling towels can lose their effectiveness quickly, especially in very hot environments. Fix, have multiple packs and towels available, and keep them in a cooler with ice packs. 2. Rehydration timing, electrolyte solutions must be administered at the right intervals to avoid overhydration or underhydration. Fix, follow the guidelines in the first aid manual for proper dosage and timing. 3. Temperature monitoring, inaccurate readings from the thermometer if not used correctly. Fix, ensure the thermometer is calibrated and used as per the instructions. 4. Shelter setup, shaded shelters or umbrellas can be bulky and difficult to set up quickly. Fix, practice setting up the shelter beforehand and choose a compact, easily deployable model. 5. Accessibility, some items might not be easily accessible or portable. Fix, pack the kit in a lightweight, organized bag with labeled compartments for quick access. Advanced tips for getting started *1. Training, educate yourself and others on the signs of heat stroke and the use of each item in the kit. 2. Customizing the kit, tailor the kit based on the specific environment and the number of people it is intended for. Include additional cool packs or electrolyte solutions if necessary. 3. Regular maintenance, check the kit periodically to ensure all items are in good condition, and replace any expired or used items. 4. Quick access, keep the kit in an easily accessible location, especially during outdoor activities in hot weather. 5. Emergency contacts, include a list of emergency contacts and nearby medical facilities. Alternatives *1. Natural cooling methods, utilizing shade, cool water immersion, or wet clothing to bring down body temperature. 2. Commercial cooling products, products like cooling vests or specialized cooling units, although these can be more expensive. 3. Hydration strategies, implementing regular hydration breaks and electrolyte replenishment during activities to prevent heat stroke. 4. Professional medical kits, more comprehensive kits used by sports teams or outdoor expedition groups, which may include advanced cooling equipment. Conclusion, a well-equipped first aid kit for heat stroke is essential for managing this potentially life-threatening condition. Regularly maintained, and easily accessible can make a significant difference in effectively treating heat stroke. Advanced preparation and customization of the kit based on specific needs and environments further enhances utility.